Good evening, everyone, and welcome to our final MLA webinar for tonight. Thanks for joining us, and we'll get straight to it. Tonight we're joined by Professor Bruce Allworth, who is going to talk to us about pain relief in sheep and what is available. So if I can get, so this control panel on your left is what you'll see on your screen right now. You should be able to hear us, but we can't hear you. To collapse that control panel, just hit the red arrow on the left of it. If you have any questions throughout the presentation or at the end, please write them in the question box and I'll relay them to Bruce on finishing. So this will be our final webinar for tonight, for this series, You can find all the webinars at the Making More from Sheep website. If you go to, I think this has changed a little bit now, I think if you go to resources and then you click on My Webinars, and all the webinars will be available for you up there. So tonight we're joined, luckily for us, by Professor Bruce Allworth. Bruce is a registered sheep veterinary specialist. He worked in Massey in New Zealand and then went to the McKinnon Project at Melbourne University. He's also operated his own sheep and beef cattle consultancy business based in southern New South Wales and Victoria for 25 years. Bruce completed his PhD in foot rot at Sydney Uni. Currently, Bruce is the Director of the Fred Morley Centre at Sturt University. Bruce is passionate about the impact and control of diseases on sheep and beef farms. Bruce also operates his own family farm at Holbrook with both wool and prime lamb enterprises and a beef enterprise. So thank you very much, Bruce. I'll give the presentation over to you and we'll get started. Good.
Okay, thanks, Hilary. Everyone should be looking at a screen there that says pain relief in sheep. Is that correct, Hilary? We're all in business there?
Yep.
Okay, good. I'll lead away here. Okay, so good evening, everyone, and thanks for joining us. I hope we haven't got you here under false pretenses. Numbnuts was in a lot of the advertising. I'm going to be talking more generally about pain relief, and I will talk about Numbnuts, but it's actually not available at the moment, but there are some products available. So for this webinar, I'm going to go through just basically a little bit what pain relief is and how pain is measured, and then look specifically at what products are available or are coming up and some of the trial data from those products, so that we can work out, or you can work out, what you should be using and why you should be using. And then there'll be room for questions at the end. I'm very happy to answer any of your questions, or at least attempt to answer them. So just by way of background, there are a couple of terms which I'm sure most of you are familiar with, but just to reinforce what they mean and their slight differences. We talk about analgesia, which is the inability to feel pain, although in most cases, we're not talking about a total loss of feeling. So analgesics are medications that act to relieve pain, and while they relieve pain, they don't necessarily remove pain totally. Anesthesia is a form of analgesia, but it makes an animal insensitive to pain by blocking all feeling. And there's two sorts of anesthesia, which I'm sure you're all aware of. One is general, which we rarely use, and we certainly don't use in routine husbandry practices. But the other that can be used is local anesthesia. And I'm sure you've all had experience of having local anesthesias when you've been to the dentist and various other minor procedures. There is also another term, which is sedation. Now, the issue is sedation may or may not be associated with analgesia. So sedation refers to just the calming or the inability to react with pain. If you've used a drug such as acepromazine to sedate rams for shearing, which is quite commonly used, while that makes the rams potentially easier to handle and certainly calmer, it does not in any way affect their ability to feel pain, so they can still feel pain. So that's a sedative rather than an analgesic. So they're the differences in the types of products that we'll talk about. Just to explain some of the work that's been done, traditionally pain has been assessed in animals through measuring a parameter in their blood known as cortisol, which increases during stress. The difficulty is that cortisol is a normal response to any sort of trauma in the body as well. And so when we're looking at, which we will be this evening, specifically at Markey and Mulesing studies, cortisol levels will rise irrespective of the treatment because of the injury that's occurred. So most researchers, even if they've measured cortisol, have found that not a particularly useful measure in measuring pain responses around Markey and Mulesing. Whereas if you were doing something that was not causing a trauma injury, then cortisol levels are quite a good indicator. So instead, most studies now tend to look at behaviour of animals and measure those behaviours and try and work out in the animal's behaviour response whether or not pain is occurring. Of course, that's much more subjective, and you can argue sometimes whether an animal that's lying down is more comfortable than one that's standing, and vice versa. So it leads to a little bit more debate, but generally speaking, it's a fairly robust way of also measuring pain. If we have a look at what's available in sheep, there are two main classes of analgesics that we use. There are the recently registered what we call non-steroidal anti-inflammatory drugs, or NSAIDs, and these work by inhibiting prostaglandin. You may have heard of the compound prostaglandin. It initiates inflammation and a pain reaction, and the non-steroidals inhibit that, and so are very useful in pain relief, particularly where the pain is associated with inflammation. So that's in terms of a wound. So the two that have been registered are one by Troy Ilium, which is buckalgesic, and that's a compound that is absorbed through the mouth, through the mucosa in the mouth. So you actually give the product as a drench into the cheek, but you don't squirt it down the sheep's throat, if that makes sense. I'll discuss that a little bit more. The other product that's been registered for pain relief in sheep is a Boehringer product called Metacam that is used given as a subcutaneous injection. There's also the product that most of you will have either used or be very aware of, which is Trysulfone, and it's one of the local anaesthetic products. Local anaesthetics block all feeling, and the classic one that we've always used in surgery on farms as vets has been lignocaine, which is a short-acting, and by short I mean 30 or 40 minutes, not hours, more minutes, but certainly useful for short-term surgery. And we also have a longer-acting one, bupivacaine, sorry about that. It lasts potentially up to 6 to 8 hours, and so it's considered a long-acting anaesthetic. And Trysulfone works is applied as a topical anaesthetic, and it contains both the short-acting and the long-acting anaesthetics. It also has adrenaline to control bleeding and cetramide as an antiseptic. The other product that's not yet available that uses local anaesthetics is a new product known as Numbnuts, and it uses an anaesthetic, lignocaine, the short-acting one, via an injection. So what we need to look at here is whether or not there's a wound present or whether it's closed. So clearly, where there's a wound, the non-steroidal anti-inflammatories are useful, and the topical anaesthetic. But Numbnuts is useful where you've got a closed wound, where you've got a closed procedure such as putting rings on. And I'll go back over that in a minute. I guess the nice thing that you'd like me to say is this is what you should be using. Unfortunately, it's not as simple as that, and my apologies for that. So I just want to go over the work. I'm not going to present lots of studies. I've got a couple of graphs up on the slide here just to let you know that there are papers that have been produced that back up all this information. But what I've tried to do is just summarise a couple of the key studies. The CSIRO and Sydney Uni have done a fair bit of work in this area, and there's some excellent publications where the main issue is whether or not you should be using Trysulfone or a meloxicam product such as buckalgesic. And what Alison Small's work at CSIRO indicated when they looked at mulesing was that Trysulfone worked well in the first 4 hours, but it was wearing off by 6 hours, even though bupivacaine should be working for up to 6 to 8 hours. In their studies, by 6 hours in the field, Trysulfone was beginning not to be much different to those that weren't treated. Buckalgesic, on the other hand, was not very effective in the first 2 hours, but was more effective between 2 and 6 hours. And possibly in some of the parameters they looked at, it was even effective much longer than that. I guess the take-home message from their work has been that combining using a local anaesthetic and a non-steroidal gave the best pain relief. So that combining the two products and giving them both at the same time, which is immediately after mulesing occurs or at the time of mulesing, gave the best result. And the other thing that they showed was that nothing stopped all the pain. So the ones, they had a group of animals that were simply put in the cradle and nothing else happened to them. All the other animals, despite even having a combination, still had higher levels of detectable pain than those that didn't have an operation performed on them, which is also pretty logical. The interesting thing about all the work on pain relief in sheep that I can find is that none of the work indicates that there is a production benefit or a large production benefit in favour of the treated animals in any of the work. So in Alison's work, they only had relatively small numbers, which makes it hard to pick up differences, small differences, but they weren't able to find any production effects when they looked at the sheep 4 and 7 days later. And similarly, when work was performed comparing or looking at the use of buckalgesic with knife castration and tail docking using a hot iron, they found that by using buckalgesic, it decreased abnormal behaviours substantially by 7-fold, but there was no effect on weight gain of the animals. I actually conducted a study, must be almost 10 years ago now, when Trysulfone was first used on 1,300 lambs, and I found a small but very small advantage in treating the lambs with Trysulfone when we weighed the lambs at marking and mulesing and then measured them again at weaning time 6 to 7 weeks later. So the take-home message from these from these studies is that pain relief works. Combining the different types of pain relief gives you the biggest response, and that in general, animals are very resilient to pain in terms of their production effects, and that any production effects are small and probably become smaller over time as animals tend to compensate for any poor doing. The other thing that was really interesting in Alison's work is that where they the more they performed the studies as we would on a farm with the animals going straight back to their mothers, the less the difference they found compared with the untreated animals. So that just reinforces that good husbandry, letting the lambs go immediately when the mothers are there so they can mother up quickly is all very helpful. There is a new product that is not yet available called Numbnuts that you may have heard of it. It's been developed jointly by Morden Institute in Scotland, and actually those that can see this photo will see the Scottish sheep in the background, the Scottish hills or the heather, and the Scottish rock in the foreground. So that's very much a Scottish picture, but it's been developed in conjunction with support from CSIRO and funding from MLA. And it's not currently on the market. I spoke to somebody at MLA this afternoon, and at this stage, they're thinking it might possibly be available late this year, probably not in time for this year's marking season for most people, but they're hopeful that it will be available for next year's lamb marking. So what the issues that we've got at the moment is that they need to get the way that lignocaine will be supplied. The way this, if I just go back a little bit, this is what happens is at the same time the ring is put on the, is applied, an injection with a dose of the local anaesthetic lignocaine is given. So the bottle's got lignocaine in it. You can see the ring there, and it's all done in one action. And it's actually very easy to use. The applicator is actually easier to use than the current applicator for rings, but I have no idea at what cost it's going to come out at. And so they've got to work out with the APVMA what the registration will be on the lignocaine so that they know how that will be supplied. And there are trials occurring at the moment, and there still are some minor changes going to the design of the applicator. So it's used whenever the ring is put on either the tail or the scrotum. Local anaesthetic is administered at the same time. I must admit, as we probably haven't got time to digress on this, but if you have a look at the logo up on the top right, it's probably the best logo I've seen on anything. That was very smart, the people who made the logo. There's a couple of pictures there, one that we were demonstrated with when I was in England last year, and another one just showing how it's actually applied. I haven't seen any studies on whether it's as quick as putting on rings, but given that it's fairly easy to handle, it's unlikely to slow the operation down greatly, I would expect, but I haven't actually seen any studies on that. So Numbnuts is something to watch out for, and I'll talk about how we might use that in a minute. What is currently on the market? This is this is taken straight from the AWI website. There's a couple of very good articles on the AWI website on pain relief. So at the moment we have Trysulfone, we have buckalgesic, and we have Metacam. Trysulfone is available now over the counter. You can get that through your normal supplier. I haven't, those sums down there have been done by someone at AWI. I can't vouch for them, but they give you an approximate idea. Trysulfone is administered at a rate usually between 6 and 10 mils, depending on the weight of the animal. Buckalgesic is 1 mil per 10 kilos. Now, it's interesting, you'll see a drench gun there. The pain relief product is placed inside the cheek of the lamb. It's not drenched down the throat. The first couple of times you do it feels a bit strange, but it's quite easy to administer. So it's done in the cradle at the time that the animal is about to have the procedure done. Whereas a Metacam is a subcutaneous injection, which contains exactly the same active ingredient as buckalgesic, and it's certainly slightly more expensive on current rates, I understand. So just looking at these ones and just reinforcing, if we look down the left-hand side there, Trysulfone is applied topically, and I'm sure most of you, from all the figures I've seen, a lot of people are using Trysulfone, so you've had experience with that. Buckalgesic is placed inside the mouth, and Metacam is given as an injection. Interestingly, the issue at the moment with Trysulfone is the withholding period of 90 days. AWI and MLA are both undertaking further studies on the actives in Trysulfone with a view to decreasing that withholding period. It's probably not an issue in terms of application at mulesing time, but if you're expanding the use to something like off shears, shearing cuts, and you're using a pain relief product such as Trysulfone, it could well be that some animals that you're shearing are going for sale, 14 to 21 days after shearing would be quite common. So that's certainly an issue in terms of Trysulfone at the moment. But otherwise, both buccal-gesic and Metacam require a supply through a veterinarian, whereas Trysulfone is available over the counter. The other point to note is, and particularly if we've got people listening that are just thinking about applying pain relief at tail docking, with using something like Trysulfone, if you're just using it at tail docking, you're putting rings on, then you can just apply it. It's fairly cheap for just doing on the tail. Equally, if you're looking at wanting pain relief for the mules, castration and tail docking, it starts to get fairly expensive, whereas the Meloxicam products act as pain relief whether you're doing 1, 2, 3 or 4 different operations on the sheep. So they provide broad pain relief to the animal at the same rate, which is 1 milligram per kilogram. So that's about 1 mil for a 10 kilogram lamb of buccal-gesic, or half a mil of the Metacam. So that's just another thing that you've got to have a look at exactly what you're planning to do. So I hope that makes sense. Now, this is, you don't need to I'm not going to examine anyone on what's in these graphs, but this is just a survey that's been recently done looking at what people are doing. And basically, a lot of people are using, as we'd expect, a hot knife for tail docking. And sorry, flick the screen there. If we have a look at the very bottom screen, and I apologise, I didn't make up these graphs. For some reason, they've changed to the rings as the dark blue in the bottom screen, but the vast majority of people appear to be castrating these days with rings rather than a knife. And just gives you a bit of a feel for what people are doing. And there's a tendency that with animals aren't mulesed, then they tend to use rings more commonly. So I guess the thing is that where mulesing is being applied, then probably a hot knife's more likely to be used. And where mulesing isn't being applied, such as in the crossbred lambs in particular, then rings might be the thing that's being used. Why have I put that up? Just to get you thinking about actually what you do, because what you use for castration and tail docking will influence what products are appropriate. Now, I've targeted this to try and include tail docking and castration, because given that it's an MLA webinar, we're not just looking at mulesing, but I'm happy to take questions across the whole area, and if I've missed one area that you want to, please ask them in the questions. So what all this means, what should I do? A local anaesthetic injection is suitable for ring application. Topical anaesthetic is suitable where there's a wound, and non-steroidals are suitable where pain is from inflammation. Obviously, they're suitable for a wound. I don't know whether non-steroidals would have any effect in terms of rings, whether there's any of the pain associated with the pain with rings is associated with inflammation. I suspect minimal, and that's probably reinforced by the fact that I could find no trials that have been done looking at the application of rings and the use of non-steroidals as a form of pain relief. So essentially, people have, at this stage, have looked at injection of lignocaine via the Numbnuts for ring application, and where there's an open wound, such as knife castration or tail docking using a hot or cold knife, then they've looked at either topical anaesthetics or non-steroidals. So I guess that means if you're using rings only at the moment, what should you do? You should wait till Numbnuts becomes available and assess that cost. At this stage, if you're using rings, there really isn't much that's been shown to be available in terms of pain relief. If you're using a hot knife and rings for castration, you could consider using Trysulfone on the tail. Again, at this stage, there's nothing available as a commercial practicality for using rings as castration. If you're using a hot knife and for the tail, or a cold knife and a knife for castration, then you can consider using either Trysulfone or buckalgesic. And there's the trial work that I actually glossed over before was specifically looking at buckalgesic in that situation. And if you're mulesing, you can consider using either Trysulfone or buckalgesic, or both, given that both gives you the best result. I guess the comment that I'd make here is that in my view, and it's certainly my view only, the use of pain relief is likely to be very important in retaining access to mulesing. So in my view, even though there aren't production effects, the sensible thing to be doing if you value mulesing is to use pain relief at mulesing. On that same scenario, that would make sense to use pain relief on tail docking and castration, and I can only get myself into trouble by saying anything more than that. But what I will say is, at the moment, in Australia at least, there isn't the pressure that there is on mulesing. The fact that we now have products available will probably help decrease that pressure building up as well. But I don't want to make too many political statements. I'm trying to keep to the facts here, but I'm happy to have discussion or make comments on that. Hopefully I haven't upset too many people there. So I think we're coming up to our time. In summary, there are 3 pain relief products available. As I've said, pain relief is important if mulesing, and it's likely to become more important with tail docking and castration. Numbnuts is definitely the product that we need to consider if we want pain relief in conjunction with using rings. And the current 3 registered products, being Trysulfone, buckalgesic and Metacam, are all suitable for open wounds. But remember that the major benefit you're going to get is specifically in terms of the welfare of the animal and decreasing the pain relief within 24 hours of the operation, and the production effects from the use, or the production benefits from the use of that pain relief will be minimal. So when you're working out the costs, that's what you need to take into account. So hopefully that gives you a good overview. I'm sorry I couldn't give you a specific definitely do this. It's got more complicated given that the more products that we have available, obviously the combination is the best, but that basically doubles your cost. So there's some decisions to be made there, and I'm happy to take questions, Hilary.
Wonderful. Thank you so much for that, Bruce. Definitely gave us a good look into the pain relief for sheep and the different options, and also different options for different husbandry practices. So thank you for that. I'll just give you a short break. Those who have to duck off, you'll be asked to complete a survey at the end of this webinar. Could you please take a few moments to do that? This information gets back to the MLA and also to Bruce to better extension efforts and to help with some further presentations. So as I said, as we started, that was our final webinar for tonight, for this series, sorry. And thank you, Bruce, for finishing that one up for us. Are you right for some questions now, Bruce?
I sure am.
Great.
Yep.
I just want to, there's a few light comments on the naming of Numbnuts, and Frank said he was telling a very respected USA sheep man, and his response was only an Aussie could think of a name like Numbnuts. So I'm an Aussie and a Scotsman, so I think we're a good team.
Yeah,
But
I'm sure there was a lot of whiskey consumed before both the name and the logo were invented, but I think they've done very, very well.
it's very clever. But serious questions now, and I think you did touch on this, but Charles would like to know, was there any effect on mothering back up using the pain relief?
No, surprisingly, one of the things that Alison looked at was mothering ability within 2 hours and 4 hours of mothering, and there was no difference with or without pain relief, which I guess is a surprise to us all. Interestingly, a pen study was done on lambs that were weaned and didn't have their mother, and their pain relief was not nearly as successful as the pain relief when the animals were released and went back to their mothers. And the thinking is that when they mother up very quickly, they tend to be more comfortable and forget about their pain, whereas if they're sitting around in a pen without anyone else, they're all feeling sorry for themselves. So I know you're not meant to really put human emotions onto animals, so that's probably inappropriate, but that's been the explanation for it. So surprisingly, no difference in mothering ability. In the study that I did with the 1,300 lambs, we found no difference in lamb mortality between groups subsequent to it either. So I guess it would be very simple if we could say they mothered up well and production was improved, but there doesn't seem to be any difference.
Yeah, interesting. So again, from Charles Bruce, are you aware of the mulesing method where liquid nitrogen is used? And do you have a view that would you like to put forward about it?
Yes, I am aware of it. The part of the studies that Alison Small from CSIRO has been conducting with her group have been to assess the use of pain relief in conjunction with liquid nitrogen. And what's been concluded is that the products that are available for pain relief at present aren't effective in reducing pain associated with liquid nitrogen. And as a result of that, and I understand that AWI at least are not pursuing liquid nitrogen as a means of an alternate to mulesing at this point onwards. Whether it's developed independent of AWI, I'm not aware of it, but I think that's the state of play with it. So it's quite difficult. We all know that if you go to the doctor, people probably don't know, but I'm a redhead. Getting a little bit old, and I have to have certain things taken off my face, and there's certainly a little bit of pain at the time. And the current products don't seem to alleviate that pain, so that's been a bit of a problem for progressing liquid nitrogen.
Yeah, I've certainly heard the same thing. So in regards to the use of Numbnuts, Ross would like to know that often when applying the rings to the testicles, it's sometimes you have trouble accessing both the testes, and it can take a couple of times to get both of them up. So do you think we'll be able to avoid giving multiple doses of Numbnuts when using this method?
Great question, and certainly when you put rings on, it's all working well, it's a piece of cake, but you get that lamb that you really struggle to get the testicle up, and it is there, and you are able to get it up, and it takes a bit and then slips back, and you're not sure whether you got it on. One of the things in developing the applicator has been to make sure that there's no chance of either multiple injections. Lignocaine can actually get up to toxic doses quite quickly, so that was one issue, and also operator safety. So it's only when you've decided that the ring's in place and you click the ring that you do get it. Now, I know we've all probably done it occasionally when we've been putting the ring on and you suddenly realise there's only one testicle there, you take the ring back off and put it on. I think what you'll find with the applicator that's been developed with Numbnuts is it's much easier to apply it more exactly, and so that's less likely to happen. I can't say it wouldn't happen, but it's unlikely to happen. So I think it's certainly an excellent question, but I think that and that's a lot of what this field trial work is all about, is making sure that it's going to be robust in the field.
Yeah, great. Thanks, Bruce. So Steve would like to know, is there a withholding period for Numbnuts yet, or do you know of it?
No, I don't know of the withholding period. It's likely to be 10 days, but until it all comes back from the APVMA, somebody may know. There might be somebody even on the webinar that can type in the answer, but I'm not actually aware of it. I'm trying to think whether I've seen it in any of the release things, but because it's lignocaine, MLA and AWI are certainly have just completed studies into that to determine the withholding period, and I'm not aware that that's been signed off, but I am aware the work's there, and everyone's acutely aware that we need to keep the withholding periods down. The 90 days with, my understanding is the 90 days with Trysulfone is associated with the longer acting bupivacaine, which is not in Numbnuts.
Yep. Yep. Next question. Helen would like to know, is there any studies on whether ring castration or knife castration causes more pain?
Yeah, that is a really good question. I've probably been to 20 different presentations from researchers on exactly that question. And every time I go there, I think, beauty, I'm going to go home, I'll know exactly which one to do and I'll adopt it. And every second one seems to disagree with the one before. And it's been one of the real difficulties with the way you assess pain. So Peter Windsor did some work about 6 or 7 years ago and addressed exactly that question, and concluded that there was slightly more pain associated with the rings than with the hot knife and open castration, but he added that given that there was pain relief, which at that stage was only Trysulfone, that the combination of pain relief with that practice was much better than rings. But there's some other work that suggests that the rings are less likely. Of course, the rings, in terms of castration, is closed, so there's no chance or virtually no chance that animals will get infection as a specific result of castration. So I think there isn't a simple answer that says one is better than the other.
Do you think that with the products like Numbnuts coming out, will it be able to sway that answer a bit more towards the rings? Or
absolutely. I would think that Numbnuts used with rings will be very minimal, but it will be about the same as a knife used if we're talking specifically with castration and the application of either Trysulfone or the use of buccal-gesic. Any of these relatively minor operations combined with any of these forms of analgesia certainly reduce the pain level to not down to as though the operation hadn't happened, but significantly lower than without pain relief. And that's what the research is very clear on. Unfortunately, as a producer, there's no real payback to us in terms of the animals are fitter and healthier. There's certainly a psychological payback to us that we're doing the right thing. And in terms of consumer, there's positive vibes from that. And in terms of retaining these extremely useful on-farm activities, then that's a benefit. So I guess we have to see our cost benefit in terms of the bigger picture rather than specific dollars from money put into pain relief at this point.
yeah, yep, definitely. Sam would also like to comment that the rings also have an antiseptic powder which prevents infections. Is that you're aware of that, Bruce? Or
the rings have that you buy have an antiseptic powder in, but it's really just to minimise anything that's going on in terms of the tail as it drops off. and the scrotum, but most of that's usually not present at the time when that happens. So because they're essentially considered to be closed, there's a little risk of infection with those anyway.
Right, yep. And with these rings, Ross would like to know, you'll be able to use the Numbnuts product with the existing type of ring that we use?
Yes, yes. So the applicator is designed to be used with the rings that are currently available. That's how it was designed. But instead of being, I don't know, most of the listeners would be aware that the current applicator's got quite a broad. I've got a small hand, and it's sometimes quite difficult when you're doing it all day, putting the rings on. This one's actually quite easy to hold and use, albeit I haven't used it very much. But it should be a lot easier to use. But rest assured, it'll come at a higher cost to the current low-cost system that we've got.
Yeah, it'll be interesting to see what that develops into. That seems to be all for the questions tonight, Bruce. So we'll just might finish up there. Did you have anything else you wanted to add, Bruce, while we're still going?
No, I don't think so. I always enjoy the questions, and I think we've covered most things. It's actually an area that requires a little bit of decision making, but it's not very complex. It's just a matter of deciding where you sit on all of these things. But at least we've got the products there, so people can make some decisions about what they use.
Yeah, great. Charles would like to say well done, and it was a great presentation. So on that note, thanks everyone for joining us tonight for our final webinar. Hopefully we'll see you again when we roll out a next series. Could you please remember to fill out the survey at the end of this webinar when you close off? And thank you very much, Bruce, for joining us, and good night, everyone.
Pleasure. Okay. So has everyone dropped off?
Not yet.